As we journey through life, our bodies evolve, and so do the risks we face. One such risk, often overlooked but critically important, is the silent stroke, especially for those over the age of 60. Unlike the classic image of a stroke, sudden and dramatic with slurred speech, facial drooping, or paralysis, a silent stroke creeps in quietly, without the hallmark warning signs. Yet its impact can be profound, affecting memory, mobility, and overall quality of life. Understanding the warning signs and knowing how to detect these silent signals early can make a significant difference in maintaining health and independence. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Brain cells begin to die within minutes. While major strokes present clear symptoms, silent strokes often go unnoticed because they may not cause immediate, obvious physical changes. However, these small, unnoticed strokes can accumulate over time, leading to cognitive decline, dementia, or increased risk of a major stroke in the future. So what exactly is a silent stroke? Medically, it refers to a stroke that doesn't produce recognizable symptoms. They are often discovered incidentally during brain imaging for unrelated reasons. Yet the absence of dramatic symptoms doesn't mean they are harmless. In fact, silent strokes can damage areas of the brain responsible for critical functions, gradually eroding abilities such as balance, planning, memory, and emotional regulation. For seniors, the risk of silent stroke rises with age, especially when certain risk factors are present. High blood pressure, diabetes, irregular heartbeat, high cholesterol, and a history of smoking, among others. Because the warning signs are subtle, it becomes vital to tune into the body and mind, noticing even small changes that could indicate something more serious. One of the most common early signs of a silent stroke is a sudden but subtle change in cognitive abilities. This might manifest as forgetfulness beyond what's typical for aging. For instance, missing appointments, misplacing items more frequently, or having difficulty following conversations or instructions. While everyone forgets things from time to time, a pattern of increasing forgetfulness or confusion should prompt attention. Changes in mood or personality can also be a red flag. Seniors who experience silent strokes may become more irritable, anxious, or withdrawn. They might lose interest in hobbies or social activities they once enjoyed. Loved ones might notice a shift in how a person reacts emotionally, becoming easily frustrated or unusually apathetic. Another warning sign involves difficulties with balance and walking. A silent stroke can affect parts of the brain that manage movement and coordination. Perhaps there's an unexplained increase in falls, stumbling, or feeling unsteady on one's feet. Sometimes it's as subtle as dragging a foot or having trouble getting up from a chair. These changes can be gradual, so it's important to pay attention to even minor alterations in mobility. Speech and language can also be affected. While silent strokes typically don't cause the classic slurred speech of a major stroke, there may be other signs: struggling to find the right word, difficulty following a conversation, or hesitating more than usual when speaking. If these changes seem new or are worsening, they warrant further investigation. Vision changes are another possible indicator. A silent stroke can impact the parts of the brain responsible for processing visual information. Seniors may experience brief moments of blurriness, double vision, or difficulty judging distances. Sometimes, they might bump into objects more frequently or have trouble reading. Because silent strokes can be so insidious, it's crucial to be aware of risk factors that make their occurrence more likely. High blood pressure is the leading cause. Over time, elevated pressure damages blood vessels, making them more susceptible to blockages or leaks. Managing blood pressure through medication, diet, and exercise is one of the most effective ways to reduce stroke risk. Diabetes is another significant risk factor. High blood sugar levels can injure blood vessels and nerves, increasing the likelihood of both silent and major strokes. Regular monitoring and control of blood sugar, along with routine checkups, are essential for seniors with diabetes. Atrial fibrillation, or irregular heartbeat, is especially dangerous because it can lead to blood clots that travel to the brain. Seniors with a history of heart rhythm abnormalities should work closely with their doctors to manage their condition and minimize stroke risk. High cholesterol and smoking further compound the risk. Cholesterol can build up in blood vessels, narrowing them and making blockages more likely. Smoking damages blood vessels and increases clotting, creating a double hazard for stroke. Quitting smoking and maintaining healthy cholesterol levels are vital steps in prevention. Even without these risk factors, age itself increases vulnerability. As the years pass, the body's natural repair mechanisms slow down and blood vessels lose their flexibility. This makes early detection and prevention strategies even more important for those over 60. What can be done to detect silent strokes early? Since they rarely announce themselves with dramatic symptoms, vigilance and regular health monitoring are key. Annual checkups that include blood pressure, cholesterol, and blood sugar screenings are essential. Seniors should also undergo cognitive assessments, which can help detect subtle changes in memory or thinking that might signal a silent stroke. Family members and caregivers play an important role in early detection. Often, loved ones notice changes before the individual does. If you observe a parent or friend becoming more forgetful, unsteady, or withdrawn, encourage them to see a healthcare provider. Documenting specific changes, such as when they began and how they have progressed, can be immensely helpful for doctors trying to determine the cause. Brain imaging, such as MRI or CT scans, can reveal evidence of silent strokes. While these tests are not routinely performed without symptoms, they may be ordered if there are unexplained changes in thinking, mood, or mobility. If you or your loved one has risk factors for stroke, discuss with your doctor whether imaging might be appropriate. Lifestyle changes are also a powerful tool in prevention and early detection. Staying physically active improves blood flow and strengthens the heart and blood vessels. Even gentle activities like walking, stretching, or swimming can make a difference. A balanced diet, low in salt, sugar, and saturated fats helps control blood pressure and cholesterol, reducing the risk of silent stroke. Social engagement and mental stimulation are just as important. Activities such as reading, puzzles, volunteering, or spending time with friends and family keep the mind sharp and the spirit engaged. These activities can also make it easier to notice subtle changes in mental function, which might otherwise go undetected. Managing stress is another essential component. Chronic stress can raise blood pressure and promote unhealthy habits like overeating or smoking. Techniques such as deep breathing, meditation, or gentle yoga can help reduce stress levels and improve overall well-being. It's also important to adhere to prescribed medications. Many seniors are prescribed drugs to control blood pressure, cholesterol, or heart rhythm. Taking these medications as directed and discussing any side effects or concerns with a healthcare provider ensures that the body is receiving the best possible protection. Regular vision and hearing checks are often overlooked but can provide important clues. Changes in vision or hearing might be related to silent strokes, and early intervention can prevent further complications. Finally, maintaining open communication with healthcare providers is crucial. Don't hesitate to bring up concerns, even if they seem minor. A sudden change in memory, mood, or mobility is always worth discussing. Doctors can perform assessments and, when necessary, order tests to rule out or confirm a silent stroke. In summary, silent strokes are a hidden threat, especially for those over 60. Their warning signs are subtle: changes in memory, mood, movement, speech, or vision. Risk factors such as high blood pressure, diabetes, irregular heartbeat, high cholesterol, and smoking increase the likelihood of experiencing a silent stroke. Early detection relies on vigilance, regular health checks, and being attuned to small changes in everyday functioning. Seniors, together with their families and caregivers, can take proactive steps. Monitor and manage health conditions, stay physically and mentally active, maintain a healthy lifestyle, and seek medical advice when unexpected changes arise. With awareness and action, it's possible to reduce the risk of silent stroke, catch early warning signs, and preserve the independence and well-being that make the golden years truly golden. Remember, the goal is not just to add years to life, but to add life to those years. By understanding the silent signals of stroke and embracing prevention and early detection, seniors can continue to thrive and enjoy the richness of every day.